Now I call upon Savita Mohan G. ma'am, research scholar, Department of Pharmacology, Vinayaga Mission College of Pharmacy, Salem, Tamil Nadu.
Good evening everyone. Myself Savita Mohan G. research scholar, Vinayaga Mission College of Pharmacy, Salem, India. Today I am here to present my research topic, in silico pharmacological screening of Vernonia elaminifolia in Alzheimer's disease. These are the contents of my presentation: introduction, aim, methodology, results, discussion, conclusion and reference. When coming to the introduction section, aging is an inevitable law of life. That means every day we are mature in life and we are moving to the aging of life. At that time, sometimes according to WHO, around 40,000 people, around 166 countries are suffering with this Alzheimer's disease. Alzheimer's disease is a progressive neurodegenerative disorder. This process is a major healthcare concern with an ever-rising global burden. It is a common form of dementia which is seen in elderly people. The main etiology is multifactorial. Actually, the main reason is not known. It is based, or this etiology of this disorder is explained with the help of different types of hypotheses. First is cholinergic hypothesis, beta amyloid model hypothesis, tau hypothesis, oxidative stress hypothesis, and inflammatory hypothesis. The predominant neurological or neuropathological features in Alzheimer's disease are extracellular beta amyloid plaque deposition and intracellular neurofibrillary tangles of hypophosphorylated tau protein accumulation. Mainly there are two forms of Alzheimer's disease are seen. One is the genetic form or autosomal dominant Alzheimer's disease form, and another is the sporadic form. The plants have a very good activity in the field of medicine. They are the rich source of new anti-Alzheimer agents due to their extensive use in the folk medicine. To solve the problem of using the traditional or the conventionally available local medicines such as donepezil, rivastigmine and galantamine, they are making some there are lot of disorders or side effects such as nausea, vomiting, diarrhea, allergic reactions, loss of appetite, headache and confusion and dizziness while using this type of drugs. To solve this problem, predicting the bioavailability properties will get a great advantages for the new drug development from plants. So hence, using the computer aided based methods like docking tools, here I docked two receptors with the help of two plant constituents like P-coumaric acid and the camphor. When we move into the pathophysiology of this Alzheimer's disease, these are explained with the help of different types of hypotheses. First is the cholinergic hypothesis. There is a reduction in the acetylcholinesterase level. And oxidative stress hypothesis, it may form some free radicals production that may lead to the Alzheimer's disease that may cause some neurological disorders or neurodegeneration. Hyperphosphorylated tau protein accumulation also may lead to the Alzheimer's disease. And the metal ion hypothesis may lead to this Alzheimer's disorder. So my aim to evaluate the in silico pharmacological activity of Vernonia elaminifolia. Next is about the materials and methods I used. I collected the plants from various parts of Trivandrum, India, and I authenticated from JNTB GRI. After that, this plant is used for oxalate extraction with ethanol. Then it is evaporated to dryness. The crude extract is used for the phytochemical evaluation. After that, I used this phenolic compound. I found out that the plant is one of the richest source of phenolic compound. Especially the phenolic compounds which is present in the Vernonia elaminifolia is the camphorol and the P-coumaric acid. Then after that, I prepared the ligand and the protein by different types of computer-aided drug designing techniques and then convert it into conventional ligand from SDF to PDB format. After that, the protein is processed and docking analysis and visualization are done. These are my results. The collected plants were collected and authenticated and extracted using substrate extraction. That found out that the value of the extractive value is 16.78% weight by bite. The results of the qualitative analysis shows that the plant is one of the richest sources of sterols, alkaloids, carbohydrates, flavonoids, saponins, tannins, protein, terpenoids, and phenolic compounds. Especially the phenolic compounds which is present inside the Vernonia elanginifolia plant is p-coumaric acid and the camphorol. So I selected two receptors, that is one HOI and the one OWT. Then the hydrogen bonding interaction between this plant constituent with this receptor is shown in the next table. That is the hydrogen bond interaction of this camphorol, which is present one of the phenolic compound present in the compound, which binds with the 1-HOI receptor. It shows that the hydrogen bond interaction was 4 and the binding affinity is -6.1. And the place of 1-HOI with p-coumaric acid shows the hydrogen bond interaction, that is 5, and binding affinity is -5.1. And the camphorol shows a hydrogen bonding interaction with one OWT receptor, that is 5. The binding affinity value is -6.6. And one OWT receptor with the p-coumaric acid, the hydrogen bonding interaction was 4 and the binding affinity shows -5.4 values. These are the docking images. First image shows the camphorol with the 1-HOI receptor binding. Second is the p-coumaric acid with the 1-HOI receptor. Next is the camphorol with one OWT receptor and p-coumaric acid with one OWT receptor. Coming to the discussion part, the study is based on the computer-aided drug design study, and the softwares used are Pyrex, Pymol and OpenPaper softwares, and the scoring functions were evaluated. The plant constituent shows a good scoring function. This is my conclusion. This investigation has revealed that the potency of Vernonia elanginifolia contains the bioactive compounds, bioactive phenolic compounds such as camphorol and p-coumaric acid, and it shows a potential role in anti-Alzheimer's activity established through CAD using most predominant anti-Alzheimer brain level receptors and found to be the most effective working through these receptors.
Good.
Thank you all.
Good. See, why did you confine the universe as Trivandrum only? Where did you collect the plants from Trivandrum only?
Actually, I collected this plant from local areas of Trivandrum because I am a resident from that Trivandrum. So it is easily available in
resorted
India.
to convenient sampling method,
Yes.
right? So ethyl alcohol, ethanol is the only solvent.
No. Based on the polarity of solvent, I selected the extraction method, but the phenolic constituents are mainly soluble in the ethanol, so I selected the ethanolic extract.
Sir, I have got a question.
Oh yes, please.
I don't know whether my question is right or wrong. I didn't get much acquaintance with your subject, even though I got an impression that you are doing research work in pharmacology.
Yes.
Everyone says that medicines for humans are firstly tested on animals. Is it necessary? Can you substantiate your answer?
Yes, sir. Traditionally, we are using different medications from Ayurveda, but there is no particular dosage form or fixed dose is not known. But when we are doing this animal experiments, we can fix the dose and toxicity of that particular compound. Before that, the time we can reduce the time of newer interventions by doing this type of in silico evaluations. That is in silico, computer-aided drug design evaluations.
Is it in rats or monkeys or some rabbits?
Yes, that is in the in vivo evaluations. That is included in the in vivo evaluations. Before the clinical trial, we are doing the pre-clinical evaluations by using this rodents.
As a pilot step, right?
Yes.
Pilot study. Is it successful?
Yes.
Okay, thank you very much.